Hello again, it's Dr. Halim Jaffer. Today it's our fourth lecture of Glossary of Periodontology. Please subscribe to my channel, HL Talent. We were in the part 1 and in the letter A. We reached to the letter AN. Today we are discussing or I'm showing you some terms containing the AN, AP and AR. And these every day it will be 10 terms to be more understandable and clear. The first one is ankylosis. We mean by ankylosis in the joint a fixation of the bone while there is, for example, a disc collapse like you see it here, or inflammation of the discs, and the disc will collapse and the bones will join together, and in this case it will lead to ankylosis of the bones. Or in the teeth, we mean a fusion of the tooth with the alveolar bone directly without the presence of periodontal ligament and periodontal ligament spaces. And most of these teeth will face fracture, of course, during extraction. Anadontia is the congenital absence of the teeth. It's either partially or completely. The term anomaly is a deviation from the usual form, location, or arrangement of a structure. Here you see the form of the teeth is changed. You have a fused teeth, and there's a supernumerary teeth, pear-shaped, and this is an abnormal discoloration of the teeth. So any abnormality or deviation from normality, either from a form, location, or arrangement, we name it anomaly. Anticoagulant, any substance or agents that inhibit or prevent the coagulation of blood. Most of those having heart diseases, especially those at risk of MI, myocardial infarction, are taking, for example, aspirin or heparin or warfarin to prevent the coagulation of blood and preventing the recurrence of the MI. Antrum is the meaning of any cavity, especially in the bone. A cavity or chamber, like you see it here, for example, in the sinus. The term apicectomy, when we have a cyst on the apical part of the root in the presence of a pulpal abscess. So in this case, we open the flap, we remove the cystic lesion, and also we cut out the involved part of the root. Then we put an MTA here. We do preparation and put in material like an MTA, and we do a root canal treatment for the tooth. So after that we will close the flap, and this is the apicectomy. While apoptosis is the cell death through fragmentation into a membrane enclosed particles, and these particles could be phagocytosed by other cells like monocytes. Arthrography is a diagnostic procedure when we do an evaluation of a joint after injection of a radio-opaque contrast material. It's mostly diagnostic. The term articulation has three meanings. It's either the contact between the upper and lower teeth during the excursive movement of the mandible, or it is a junction or union between two or more bones, or it means a skeletal joint. The last term is artifact. Artifact, most of the times we see it during taking an X-ray. Any unnatural and misleading conditions while taking an X-ray, which happen due to imperfect technique or material, we name it an artifact. For example, we see a black dot here or something like that, or a broad line, radio opaque or radio lucent throughout the teeth. And so all of these are misleading due to improper technique or improper material using during taking the x-ray. So this is the last term. I hope you enjoy it and follow me for more videos. Thank you.